Paris, millions more Americans could soon be eligible for COVID-19 booster shots, and they'll have much more flexibility with which shot they get. Earlier today, the FDA authorized so-called mix and match boosters, and a CDC panel meets tomorrow. Now, that comes on the heels of a study that showed getting a different brand than your first vaccine series still boosted immune response, and in some cases, showed better results than getting the same shot. Meanwhile, the White House is outlining its plan for getting children 5 to 11 vaccinated once that age group is approved.
We will be ready to get shots in arms. Kids have different needs than adults, and our operational planning is geared to meet those specific needs, including by offering vaccinations in settings that parents and kids are familiar with and trust.
And joining us with the latest on the ongoing COVID vaccination effort are Dr. Richard Freeman, Chief Clinical Officer of Loyola Medicine, and Dr. Beverly Shaw, Professor in the Division of Infectious Diseases at Rush Medical College's Department of Internal Medicine. Thanks to you both for joining us. Dr. Freeman, let's start with you, please. So as we just heard, the White House is rolling out details on plans to vaccinate children 5 to 11, and they're focusing on settings like doctors' offices, community health centers. Why is that important, especially for younger children?
I think it just goes to the fact that it'll be a better environment for children and their parents so that they can stay together and be in an environment that they are comfortable with, and to enhance the ability to vaccinate folks as quickly as possible. We don't want any hesitancy in perhaps thinking about bringing your child to a large auditorium or something like that we've used in the past.
Kids are also notorious for crying, which could impact. What are some of the different needs that we just heard in that soundbite that kids have when it comes to getting vaccinated?
Sure. Well, their surroundings, obviously a different dosage and sometimes different equipment for administration. So we're trying to take all that into account. Certainly, it's easier to get your vaccine close to home, and we're trying to promote that as much as possible as well.
Dr. Beverly Shaw, how important is it that we get this age group vaccinated, especially since so many children are back to in-person learning?
I think it's very important. Certainly, we know transmissions can occur in schools between children who are unvaccinated and between children and the teachers and other staff in schools. When children get ill from COVID, then they bring it home to the rest of their family, including potentially grandparents who may have underlying health conditions and themselves may not have responded as well to the vaccine as we would have hoped. So it is important to try and protect, the whole family, including children, which can be a vector for bringing the virus into the home.
Absolutely. So federal agencies are expected to approve, or we know that the FDA has already approved the mix and match booster shots this week, CDC panel meeting tomorrow, meaning you don't necessarily have to get the same kind of COVID vaccine as you got for your first sequence. You could switch. If you got the Pfizer, you could get the Moderna. Dr. Freeman, what is your reaction to that?
Well, I think there's two things to consider when you talk about that. The first is just a practical logistical matter, in that to get as many people a booster shot as possible, it's going to be much easier if we're able to mix and match. I may have gotten one type of vaccine at my vaccine center 6 months ago, and they no longer have that type of vaccine available. So logistically, it makes it much easier to get people their booster. The other thing to think about is that the science actually seems to show there may be an advantage to mixing and matching, in that you develop a more broad and robust immune response. We don't know what variants might occur in the future, and it might give you a more broad response and an ability to counteract those variants if they arise.
Dr. Shaw, any concerns? Could this create confusion?
I think it could create some confusion, but I actually think, as Dr. Friedman pointed out, it will make things much easier, that it really isn't so important perhaps which subsequent vaccine you get, unless, of course, you had a reaction to one. But just making sure you get the proper doses and a booster dose if you're indicated to get one.
Now, there are reports today that the boosters may eventually expand to people as young as age 40. Dr. Freeman, is it possible that the COVID vaccine could be like the flu shot, something that we need annually? Do we think 3 shots will be enough?
Well, I think the short answer is nobody knows for sure. But if you look historically at many things that we receive vaccines for, it's not unusual to require 2 or 3 boosters. And I think that's probably where we're going to end up with COVID. You may need 3 shots to get lifelong immunity, not necessarily a yearly shot like the flu. Only time will tell, but I think that's where a lot of folks are saying we'll end up.
And Dr. Shaw, Governor Pritzker said yesterday that state officials hope to lift certain mask mandates in time for the holidays. Any concerns that we could see a spike in cases?
Well, I think we always have to be conscious of watching the case counts and making adjustments as dictated by what is happening in the community. I think, we all hope that we can loosen mask mandates over time when community rates drop and it becomes safer not to mask. I think we do have to be aware, though, that masks will always add some additional protection to vaccination, as none of our vaccines are 100% effective.
And Dr. Shaw, this week we also know that former Secretary of State Colin Powell, his death from COVID complications brought new attention on the issue of breakthrough cases because he was reportedly fully vaccinated. What do you say to people about breakthrough cases in this instance?
We have definitely seen more breakthrough infections related to the Delta virus, which definitely is more infectious than earlier variants. Overall, the vaccines, though, have still held up in terms of preventing most cases of hospitalization or death. Obviously, Secretary Powell did pass away of complications of COVID. However, in the news, it was reported he did have an underlying cancer, which I suspect affected his ability to respond to the vaccine. And that's why it becomes important for all of us to get vaccinated, because if he hadn't been exposed to COVID, if all the people around him had been vaccinated, he might still be alive today.
And Dr. Freeman, before we let you go, I can't let a pair of doctors go without asking about the flu shot because we are heading into flu season, colder weather, more time indoors. How important is it to get that flu vaccination this year compared to last?
Well, it's vitally important. It does help prevent the flu. And in our current environment, it also helps you not contract an illness that looks like COVID, right? So if you have the flu, you're going to probably end up having to have a COVID test to make sure it's not COVID and go through that whole process. So not only does it help prevent the flu, but it helps you have some peace of mind and not have to go get a COVID test and go through that whole process.
Yeah, a process some of us have gotten familiar with over the last year and a half. Dr. Richard Freeman and Dr. Beverly Shaw, thanks to you both for joining us.
Thank you.
Thank you very much.